Good afternoon to all. My name is Joyce L. Clipper. I'm from Public Health Initiative Liberia, and I will be moderating our section today for Liberia under the theme building partnership across actors and sectors for better health. Basically, for today's section, we are going to be able to have civil society, parliamentarians, and the Ministry of Health, as well as youth rep and the media share progress made on the Liberians' commitment as it relates to the PMMCH call to action that was made in December of 2020. And during this section, the panelists will be able to share key learnings along the way and what is being done, what are the challenges. It's a free conversation. All will be allowed to ask questions to the panel as they see fit. And we hope that the panelists will be able to respond as well. For our panel today, we have 4 speakers. And the first speaker is Bentu Tiahunge. She is the director of the Family Health Division, Ministry of Health. And we also have Honorable Moema Briggs Mensah, member of the 54th legislature of Liberia. She's a key ally to the Ministry of Health and Civil Society as it relates to advancing the needs of women, girls, and adolescents. We also have Reduxing Esfire, a journalist, a health journalist that have worked in the sector for the past 25 years and have been one of the pioneers as it relates to narrating the stories of women and girls within the health sector. We also do have Chitumu Dutton, last but not least. He's our youth, child and youth rights advocate. He's currently the FP 2020 youth rep and also the GFF youth rep. He comes from an organization called Shalom Liberia. So these are our speakers for the day. And I am your humble moderator, Joyce L. Clipper. The goal of this section is to generate dynamic discussion from a diversity of voices across a range of various groups and sectors, as well as showcase the best practices of coordinated partner-led efforts to support the realization of government commitment for women's, children, and adolescent health. At the end of this section, we hope to achieve our desired outcome for this section is that government's need for commitment delivery expressed and all PMCH partners are well informed to deliver coordinated efforts aligned with priorities. And also we hope that after this section, we can have an energized and inspired participants who would take their learnings and best practices to encourage their own governments to make public commitment for women, children, and girls' health, as well as support adequate advocacy and accountability measure for delivery of same. Thank you. I just want to see the participant listing to see if we have one of our key panelists in now. So we have, okay. Welcome, Madam Tiahunge. It's a pleasure having you here. Sorry for the mishap for the initial stage. We say welcome.
Thank you.
Yeah.
Thank you.
That is Madam Bentu Tiahunge, who is the head of the Family Health Division. So, Madam Tiahunge, I know that from the initial onset, the Liberian government, through the leadership of the Ministry of Health and the department in which you head, has been key in pushing and ensuring that the needs of women and girls as well as adolescents is met during this critical period of COVID-19. I would like for you to clearly share with the participant in here today, following the government commitment in 2020, what are some of the institutional efforts that have been led or undertaken by your institute budget division, and we will be keen to hear some of the progress made towards delivering these results. Thank you.
Thank you very much. And I want to say thanks to the organizer of this very important forum. And as you've rightly said, it is my duty and my focus to ensure that women and children enjoy more health in this country. And yes, the commitment was made December 2020, and this commitment stemmed from the fact that equity should be assured, and we should make sure that women and children have optimal services that will make them to lead a good life and life. And so since we made the commitment, there are a lot of progress that have been made, though we are still in the process of making sure that everything that was committed is come to fruition. Among what we've done, we've looked at adolescent, because adolescent is key to us. If you look at 2013 DHS tell us 3% of our 4.7 million population are young people below 24 years, and so you know what we have on our hands. So the first thing that we took note of and started working on is making sure that the adolescents have standard services. And so we've added WHO Global Standard Toolkit for Comprehensive Adolescent Health Services Provision. And that piece of document is to help us, all of the service providers, to be able to provide the requisite quality services to these people. The next thing that we've done, we try as much as possible enable the environment where the services are provided for the young people as well as all the other beneficiaries. And before, it's been one of the key issues we had, what the facility where these services are provided lack critical equipment to help with diagnosis and treatment. And so after we did that commitment, keeping focus of that commitment, we have been able to provide about 60% of our facility with critical equipment, especially the tertiary facility that are the comprehensive EMOG facility. So equipment like ultrasound, the O2 concentrators, and the blood bank, so that women and children and everyone else that will be blood ready. We also look at the issue of COVID, ventilators, an issue. So we try as much as possible to make those available. And the O2 concentrator also in line with the COVID was also an issue. But then not only enabling the environment, but even those who will provide the service. So we've been able to train our health workers across the country, especially alleviating the fear of COVID so that they don't abandon the services but are there and making services available to everyone. We also look at the adolescents themselves. So what we've done in recent time is to integrate adolescent-friendly services into routines so that wheresoever you find yourself as adolescent young people, wheresoever facility you go to or any outreach activity you find yourself, you will be able to have the requisite services. We all making the adolescent very comfortable. We have been able to establish adolescent-friendly centers across the country so that they are able to sit, because you know they are waiting for the waiting time. They're so want to be in area where they have the peers while they are waiting for their services. We also try being cognizant of equity. We are trying as much as possible that everyone, especially young people, women, and children who need requisite COVID services during this pandemic are given the relevant services irrespective of their status in society. Key to that also, we are keeping our communication line open to everybody, the service recipient, the service provider, the youth, so that we give them feedback and they also give us feedback to be able to be on track, making sure that we are able to live up to our commitment. So we'll stop here for now, and as the conversation go on, we'll bring in some of those things that are going on.
Thank you, Manager Hungay, for sharing the progress being made so far. Jutun, you have been working within the youth community in Liberia as it relates to adolescent girls and women health issue. How have you been able to, how has the youth community in Liberia been mobilized to leverage the commitment for powerful advocacy? What have been the outcomes of your partnership with the government of Liberia to enhance community engagement mechanism for the commitment delivery? Thank you.
Okay, thank you, Joyce, and I'd like to thank everybody for coming up here and for us to have this unique conversation. And as a youth representative in Liberia, we feel passionate about working with the government and other partners to ensuring that young people access to quality health care is ensured through evidence-based advocacy. However, young people, as you all know, account for about 65% of Liberia's 4.4 million population. And to me, this means that Liberia has a youthful population that is capable of serving as either a driving force for the successful implementation of the PMNCH commitment, as well as advocate for the inclusion and participation of children, adolescents, women, and young people in sectors relating to their health and well-being. However, Liberia, as a West African nation, made its commitment, as you all know, in December 2020, to ensure that all adolescents in Liberia have a fair chance to live fulfilling lives and enabling them to achieve their full potential by securing investments in adolescents and well-being. So, as a youth leader of Liberia and a passionate SRHR advocate, we have been able to engage about 15 youth-led organizations. I mean, 15 youth-led advocacy organizations with the purpose of actually educating them about Liberia's commitment, PMNCH commitment. So we realized that youth-led organizations have the capacity to remind the government about its commitment to bettering the lives of children, adolescents, and women through evidence-based advocacy. And we also strongly believe that this can only happen when those young people understand the commitment Liberia has made. We all know that there is still a gap, and for this, we also strongly believe that there is a need to have more consultations with local youth-led organizations as well as CSOs to having a clear understanding of Liberia's PMNCH commitment. And we also believe that once that is done, it will help the youth-led organizations, the civil society organizations to remind the government when it comes to its commitment. Sometimes the government becomes it becomes a burden for the government. The government makes a whole lot of commitments to different programs and different aspects of society, and sometimes implementing it can be a challenge. But once you have the young people who are passionate and are part of different youth-led organizations, are part of that, they can remind the government through their advocacy. That is why it's important for us to have such consultations with not just 15 youth-led organizations, but to go as far as reaching out in the local, the subnational areas, which will also be the counties, and try to provide those information for them. Thank you.
So just to highlight what Jutun said, through his leadership, he has been able to mobilize up to 25 youth-led organizations on the Liberia's commitment, and has been able to work with government, though government has lot of commitment that they have committed themselves to. However, in the face of these competing priorities, the youth continue to engage government to deliver on its commitment. Thank you, Jutumo, for your leadership. It's always great working with you at the home front as well. Do we have the representative on already? Is the media here? Okay, if we cannot have any of those people in, we will allow questions from the participants for like the next 15 minutes. And followed by that, we have other questions that Madam Tiahunge and Jutumo will be able to address themselves to. Thank you. Any other question from across the participant regarding what Madam Tiahunge just shared as it relates to government on progress being made, as well as the civil society from the youth perspective? The floor is open for questions. So the panelists, as we prepare for our next round of questions to the panelists from the moderator. If you have question, either you raise your hand or you can type your question in. Okay, thank you, Maja Santos. She's asking, how are you addressing subnational reach? Madam Tiahunge, can you address yourself to that?
Definitely. So subnational reach in this context, in my mind, is reaching the suburb of Liberia. Like in Liberia, Monrovia is not Liberia. So what we are doing here to ensure that the standard that is produced at the urban area or in Monrovia is also the same across the country. We set up different levels of masters trainer, as we call them. So you have the national level trainer, the national level trainer who train the county level then train the district level, and then the district level went with the facility, making sure that the same quality of care that we find in Monrovia is the same that we find in the suburb. The next thing that we are doing, we know that we are challenged by rules and other geographic issues. So we work with our partners and with the government, and we are able to set up outreach services. And the outreach services, because if we want to achieve universal health coverage, leaving no one behind, we should be cognizant of the geographical territory not being a barrier. Whether she lives across the river or at 2 or only 3 living there, they must have the same quality services. So we have seller outreach services across the country. Right now, we try to also have the health facility, that is the hospital, which is the tertiary facility, providing outreach services to the health center, because we have TS in Liberia. We have the health center, we have the clinic and the hospital. The next thing that we are going to also reach the suburb is we are working along with the community leaders, the youth themselves in the community, whether you are urban or rural community, and also we are working with the traditional and religious leaders. Some of the things that we try to remove of that, doing the commitment that we are addressing ourselves to, has to also do with cultural, traditional, and religious. So we also work with these people to where they are at their own community, because the same way we don't have no 2 countries as the same, still don't have no 2 uh, county or community the same. So we want them to be. So there are some things, and these are just among what we do to reach them with whatsoever services that they show. The standard that is set up on COVID pandemic control in Muscle or the urban area are the same setup in various counties that we even call the province or region. So we are having several strategies to make sure that services and the quality of services are delivered to everyone wheresoever they are found.
Thank you, Madam Tiahunge. Just to highlight some of what she said, that there's a coordinated mechanism whereby it's a step-down approach. Whatever is done at the national level is also done at the peripheral levels to ensure the same quality of care. Despite the challenges in road network, Liberia uses other mechanisms such as outreach services to reach difficult to reach community or last mile communities. And as well, government and partners continue to work with community leaders, youth leaders, as well as traditional leaders to ensure that these commitments are not just done at the national level, but that also the communities, the youth, they are all involved as it relates to addressing the needs of women, girls, and adolescents, even in the face of COVID. Thank you, Madam Tiahunge. Jituno, there's a question here for you. It says, how well is the youth coalition you mentioned connected with the government institutions to promote meaningful youth engagement in decision-making process? Thank you.
Yeah, I'd like to thank you for the question. You see, Liberia is a country that is guided by rules and regulation. We do not just, the government here in Liberia do not just allow any organization to come from the blue sky and start to work for young people and just start to do anything. All of the institutions that do work for, the local people, the community, girls, adolescents, and the list goes on and on. I register under the government of Liberia. That is to say that the government is aware of all of those institutions that are working. However, all of the institutions, those local government, local youth-led organizations we are currently working with, the government is clearly aware of them, and they have been doing extremely well, especially in the area of adolescents, youth sexual reproductive health, and the rest of that. So the youth-led organizations that we are currently working with, they are highly, they got some good relationship with the government, and we do not see it as a competition, but as a platform for collaboration, and that we work together to achieve the implementation of the PMNCH commitment. Yeah.
Thank you, Jituman. That question was from Sharaf Obakimvo. I hope your question was responded to well. Just to give a highlight of what he said, that they are ensuring that through a well-coordinated mechanism that work with all relatively youth organization within Liberia to ensure that their voices are amplified as he is representing them to the Ministry of Health as well. Thank you. Now that we have exhausted most of the questions that came in, okay, there's one more question. What are the challenges that the government has faced in bringing together all partners around this issue? Madam Tiahunge, this question is coming from Kadi Ture.
So I want to say thanks to Ture for that question. we are told by a common saying that if you say you have no challenges, then you are not on earth. So cognizant of that, there are several challenges, but what we try to do is to beat them. One challenge is making sure to have body buy-in. We have to keep advocating. We have to try to work with everyone, starting from the higher level of government, the parliamentarian. Like I say, the country has a power that has to be shared between several sectors to advocate with the House of Representatives, or we call them the parliament, that are the one who share the piece of the pie. And it's a thick competition, trying to make sure that people are convinced why certain things should be funded. The second thing that we have is with our partners. Of course, we are not the only country that the partners are supporting, and so we continue our advocacy and we continue to work seriously to make sure that we in this competition are recognized and are considered for whatsoever funding envelope there is. We also have challenges trying to having partners align their resources with our priorities. But for this, we discuss on our coordination platform, and we then found what we call like a common ground, and then we move from there. And so the challenges are numerous. One, again, that I talked about earlier are the cultural, the traditional, the religious challenges, and some family planning. And somebody will say, oh no, my religion not accept family planning. Then we have to structure a strategy that particular group of people, and we have to work with them until if not having a buy-in of everybody in that, at least we will have some champions who will agree and then continue to champion the cause among the rest of the people. So we have numerous challenges ranging from funding to traditional to religious, and also to our own domestic funding envelope to be able to fund most of these things that we do. So we see our challenges in Liberia as an opportunity to be able to tie in more with those that we have to advocate with. Thank you.
Thank you, Madam Tiahunge. There are challenges. However, the Ministry of Health continue to work with partners and others to see how to address that despite the squeezing finances within the sector. Which we have just been joined by Honorable Moima Briggs Mensah. She's one of the speakers on this panel. She's from the 54th legislature and one of the forerunner when it comes to the issue of women, girls, and adolescents. Welcome, Honorable Moima Briggs. We have a question for you. Glad that you joined us. I'm sorry for the mishap earlier on. However, Honorable, we would like to know how has the House of Legislature of Liberia been involved in providing oversight for the delivery of the commitments made by the government as it relates to the issue of women, girls, and adolescents. Thank you. Honorable Mensah, are you for oversight as it relates to the commitment of the Liberian government? Tiange, you are going to answer a couple questions for us. Thanks to all of our participants for those wonderful questions that have been asked. Like we said, here is to learn from the Liberian team on what is being done, what are the challenges, and also to inspire and energize each and every one of us as we leave from here to be able to mobilize our community to push for accountability as it relates to the government's own commitment on the COVID-19 call to action. Madam Tiawunge, thanks for all of your responses that you and your team are doing a wonderful work. What will you say are the government's need to accelerate commitment fulfillment? What is your ask to the PMMCH partners at the national and global level?
Thank you very much, Joyce. This is one of the key things that I hope you have asked, and you actually have asked that. This commitment is considered as a key priority for us at the government of Liberia. And so we actually want our partners to see need to align their technical support and their resources to the commitment so that we are able to fulfill this commitment. The support that our partner will give us will go a long way in making sure that this commitment is achieved. We want to also always encourage our partners. This commitment should be seen as a common framework for action. We have attached a lot of concern, a lot of importance to this. This is a common framework. We want our partner to see this so that us governors our effort around this and making sure that this commitment is fulfilled. Once fulfilled, that shows that we will have gone deep into making marks for the women children of this country. So in a nutshell, we are encouraging our partners to help us see this commitment as a common framework that we all can work towards with our funding and with our technical support. If our partner technical support and their funding are aligned toward this commitment, we are optimistic that we will fully achieve this commitment. Over to you.
Thank you, Madam Tiahunge. Thanks a lot. There were a couple of questions for Jutumo that I jumped over. Sorry, that did happen. Jutumo, there's a question here from Tiago Luchusi. It says, is the movement also advocating for improved immunization in Liberia?
George, you were coming in broken. Can you ask the question again?
Yeah, there's a question from Tiago Luchuzi. It says, is the youth movement also advocating for improved immunization in Liberia?
Yeah, Tiago, thank you for your question. I will say yes to your question. Right now, what we are doing, the correlation of young people we've brought together so far, which is over 15, between 15 to 25 youth-led organizations. What we try to do now is to give some attention to the PMCH call to action, looking at the commitment, trying to provide some education. And the reason why we're doing that is for those youth-led organizations to see Liberia's commitment, Liberia's PMNCH commitment as their own, and try as much as possible, since they are advocacy organization, to remind the government because our job as advocates, as youth-led organizations, as civil society organizations, is actually to remind the government of its responsibilities and commitments, promises it has made to improving the health and well-being of children, adolescents, and women. So we've been doing extremely well, and so we continue to do that with those young people. And as we continue to do that, I'm very optimistic that the commitment Liberia has made to the PMNCH will be actually implemented. And at the end of the day, we see a better, health system and a good health delivery that benefits not just the advocates, but everybody, especially adolescents, women, as well as children. Thank you. Joyce, is back to you.
Yeah, just one more question for you, Jutumo, but I see Honorable Mensa is in. So it's great to see if we can have responding to our question initially. Honorable, it's great to have you. It's an honor having you on this platform, despite today being your session day. My question for you initially before you drop off was, how has the House of Legislature been involved in providing oversight for the delivery of the commitment made thus far by the government as it relates to women, children, and adolescents? Thank you.
The first thing I would say, sorry, I'm coming late. I've been on another platform thinking, and you were very helpful to direct me back. But I would say that, the legislature, we have three cardinals responsibility, which is lawmaking, oversight, and representation. So in that we have been able to do laws, especially like the domestic violence bill, which cover all of these areas and that give a lot of protections to women and women issues. And then when you come also to our oversight, we have the gender committee and we also have the health committee. And that is what I always say. These committees should be people that will not just cite you, but should be committee that you will reach out to with your challenges and make sure that it's done properly. And with that, it helps you in doing it. So with the domestic violence bill and also all of the Vera Oversight Committee contribution with that is where we come in as lawmaker to give our contribution in the process. So let's say if you have challenges with budgetary allotment to these areas that will help adolescent girls, before the budget can even reach, you must be able to approach the gender committee and the health committee to tell them your challenges. So with that, they as oversight committee also to make sure that those things are addressed to be able to have a smooth working relationship to make sure to meet the demands and needs of these people that are affected.
Thank you. Thank you, Honorable Briggs. Thanks a lot. She spoke just to highlight some of what she has said, that parliamentarian, that one of their cardinal role is to provide oversight. And most oversight begins from budgetary process and also the implementation of that or onto the execution of the budget. As member of the parliament, she worked across various committees to ensure that the needed oversight as it relates to the needs of women, girls, and adolescents are addressed according to the budget, and that this is not done in silos. They have to do it in collaboration with the Vera Ministry, like the technical arms that prepare those budgets. And as they share their challenges, they as representatives are able to bring that argument to the floor to be able to address those issues. Thank you, Honorable Briggs Mensa. Is there any question for the Honorable? If you have questions, we have a few more minutes to go. We have 4 more minutes remaining in this session. And as we leave from this session, Jutum will serve as our repertoire to the bigger platform. And yeah, just to highlight some of the issue being discussed here today, the government of Liberia took leadership from the onset of COVID to commit herself to addressing the needs of women and girls despite COVID-19. And during that period, they were able to support infrastructure refurbishing, ensure equipment, supplies are provided at health facilities, and ensure that there are instruments and protocols to address the needs of women and girls if COVID-19. All has not been very great. There are challenges. Government has a lot of commitment that they have committed themselves to, and this makes the funding space very tight. As such, there's still a need for collective advocacy in Liberia to reinforce what is ongoing and to ensure that Liberia can fully deliver on its 10 million commitment as ensuring within the call to the COVID-19 call to action.
Yeah, George, thank you. I've been taking notes. Thank you very much. I will soon be, you can see my phone. I'll be joining one session quickly to report to them all of the things we've been doing. Yeah.
Okay, so to close up.
Hello, George. Hello, George. I think it would be good.
Yes.
Hello, George. Before you close, I think it will be I think it will be good if we also have the link to join the bigger session where Jutumi will be doing this for us.
Okay. Benjamin, the link to the bigger platform, I'm sure is going to be shared, or we are going to move to the bigger platform from India simultaneously. I think it's the tech team going to just take us onto the bigger platform. With that being said, Manatiahunge, what is your parting statement, please? 1 minute.
Oh, so my parting statement is that I'm very grateful for this platform. I suggest that we have such platform more frequently. We can all decide what frequently is, but it's good. It brings all together to be able to listen to one another and maybe learn some good lessons from one another. I also want to extend one of my champions in the house, Honorable Briggs. Thank you for making it at last. And we always knock on her door. And I can tell you now, because she's here, she's never tired answering us. So thank you so much. Thank you to Jutumo. You've done well with the youth, and please continue. Thank you all. And I can find a way to come together once more. Maybe our partner here, our core, and align technical support and resources to this commitment so that we all ensure that we achieve it. Thank you.
Thank you, Manatiahunge. Honorable Briggs. Mensa, your party statement, 1 minute, honor 1 minute, because we almost.
Okay, Joyce, thank you. Sorry I couldn't be around for us to do more. Together, I'm always open to see what we can do. Like I said, the action point may be many, but what we need to do, remind ourselves and also have people on our back and reminding us for every one of us to work together to achieve those things. And that is why most of the time our focus has been on the issue of prostitution, the issue of the traditional midwives, especially I come from a rural district, looking at it seriously, the infant mortality rate is linking to the traditional mirror, what we can do to make it better. Because if the clinics don't have drugs, it becomes difficult for pregnant women to come to the clinics to deliver. So there is a lot we all can do together. And once we work together and remind ourselves and one another, keep on one another back, we will achieve it. Madam Tenge have been very better. And we stick at the midwives, traditional midwife bills that we're working on. And she's also been very helpful in the process. And I just say, I'm always open, like everyone else, work together to achieve better, that we all will make it work for Liberia.
Thank you, Honorable. For all of us that will be joining the live platform, the closing section, the link has been shared in the chat. We can just click on it to be able to join as we close from here. And Jutumo, just few seconds of parting statement. Thank you. Jutumo, are you there? Okay, so the link to join the closing section has been shared in the chat. It was great having you on the Liberia Parallel section. We hope you all learned a thing from Liberia and that we all are energized to be able to go back to our various countries, be able to inspire our various constituents to mobilize for governments making good health commitment as it relates to women and children and adolescents. It has been a wonderful time serving as your moderator, and we look forward beyond this platform to engage. I'm on Twitter and on LinkedIn, all of the social media platform, I'm there. So we all can engage collectively as most of the speakers are on this, connect with them and all of the best. Thank you.